teenage child is struggling with functional neurological disorder, short for FND, but also other conditions such as POTS, chronic fatigue, post-concussive symptoms or syndrome, or chronic pain? If so, watch this video because I'm going to talk about how all of these things are related and what can your teen do, this one thing. What can she do, this one thing, to help address all of these symptoms at the same time? So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy. In today's video, I'm going to talk about FND and other conditions and what your teen can do to help with these conditions. But first of all, what is FND? I will continue to talk about this over and over again because there are so many people who are getting diagnosed with this condition pretty much every day. So FND is an umbrella term to describe this cross-wired network communication problem between the brain and the body, even though your child's brain and body are physiologically and structurally quote-unquote okay. It is a real diagnosis. It is a biopsychosocial problem. So it's not just one thing that is causing the problem. Unlike the adult who's got diagnosis of FND, who is usually, statistically speaking, the majority of the time is based on childhood trauma or anxiety or stress and things like that. With teen FND, that's like the less than half of the case. So again, teen FND is not necessarily the same thing as an adult FND, and that's why I am so passionate about being specific and specializing in working with children and adolescents. Anyway, let's keep going. So let's talk about POTS. It's not pots and pans, but POTS stands for postural orthostatic tachycardia syndrome. So basically, it is a condition where child's heart rate suddenly increases from laying down to sitting or from sitting to standing. So based on the posture of your child's body, your child would be feeling super dizzy or sometimes faint because all of the sudden increase of heart rate, and then it's really hard for the brain and the body to kind of adapt, to the change. So that's essentially what it is. And chronic fatigue syndrome is basically a fancy name for consistently feeling super tired, low energy, and brain fog. Sometimes pain is also included, regardless of the body part. And also the poor sleep. So all of these things are part of chronic fatigue syndrome. And then there's a post-concussive syndrome. It used to be called post-concussive syndrome, but now it's persistent post-concussive symptoms. All these people like to come up with different names. But anyway, so post-concussive syndrome is a part of traumatic brain injury, and it's classified as a mild form of TBI, the traumatic brain injury. And you are basically going to get this PCS diagnosis if the symptoms of concussion last for a certain period of time. Generally speaking, if your child is having these symptoms of headache, dizziness, gait problem, BOMS positive, it's not like vomit, but the vestibular and oculomotor symptoms are positive. So like eye tracking, the vision disturbance, inner ear balance, all of these things are off, and then having some sort of like a body weakness. If all of these symptoms or some of the symptoms are present for over a month or so, then it's pretty safe to say, yeah, your child continues to have this symptom of concussion, which leads to this post-concussive syndrome. And all of these things, how everything goes together is really part of FND is also having fatigue, dizzy, and pain. So all of these things kind of are mingled together. And depending on who you see, really, the doctors will give you these additional diagnoses as a post-concussive syndrome if there is an injury of the concussion present, and the chronic pain, chronic fatigue, and POTS, and things like that. Sometimes a concussion can lead to chronic headache. Sometimes a concussion can also lead to something called dysautonomia, which is, again, an umbrella term that goes into POTS. And then the vision disturbance and feeling super tired and poor sleep and all of these things can go together. That's why where it gets a little bit difficult to diagnose each and everything. However, with FND, a lot of these things can go together. Sometimes, as I mentioned, concussion can be a trigger for developing these FND symptoms and conditions. But what we have all in common right now that we know of is this dysfunction of autonomic nervous system. So anything and everything your child is experiencing, whether it's a POTS, chronic fatigue, chronic pain, post-concussive syndrome, all of these things on top of FND, what they have common across the board is the dysfunction of autonomic nervous system. So what is this one thing that your child can do? Well, simply put, it's a physical activity. So I'm reading off of this scientific journal that came out, and I'm going to post a link down below so you can actually read the article yourself. But just to kind of give you the summary of it, in this article, what they're talking about physical activity is basically any kind of body movement. And in that, there can be exercise, sports can be one of the exercise activities that is like scheduled, planned, organized, structured, that kind of thing. And it could also be a physical therapy that was prescribed by a healthcare provider, usually a physical therapist or a physiotherapist. So then you can work on this systematic way to strengthening and conditioning to get your life back. And then there is this gentle, mindful body movement. So it could be yoga, stretch, Tai Chi, and, stuff like that, right? So it's not necessarily like rigorous exercise activity, but it's still part of movement, right? And I had a video talking about why physical activity is really helpful for managing the symptoms of FND. And guess what? You can absolutely watch that video too. However, the physical activity also is really beneficial for other conditions as well. Okay, so how much and how quickly is really always the questions that I've been asked by so many families. And they're like, well, our child has been so deconditioned, and so it's really hard to get back in, on track and stuff like that, right? So two things to think about when it comes to physical activity. One is baby steps, gradual increase of activity. So it could be starting from zero. Sometimes it's from a negative, if it's super sedentary or deconditioned, but start somewhere and then gradually increase that level of activity. And second part is a pacing. So basically, it's a fancy name for taking pre-programmed breaks based on time and sets of activities rather than the fatigue level. Look, if your child's already having FND symptoms and then having super tired and having pain and things like that, it would make it really difficult for your child to get into activities because most of the time they already feel tired or they're already in pain, or any activities can make these symptoms worse, right? So why is that? Why does it happen when your child is being active makes things some symptom worse? Well, there's so many different theories and hypotheses, but what we do know are largely like three categories. One is your child has been deconditioned. So that means the muscle mass and strength and then kind of muscle memory has been sort of lost. So it takes a bit of a time to get into the momentum, right? So that's why it seems and feels for real like the symptoms are getting worse. Even if it could be muscle soreness, for example, then they are thinking as of worsening pain, for example. And if you go through super rigorous activities, at the end of the day, everyone will feel kind of tired, right? Or like, oh my gosh, I'm ready to go to bed, kind of thing, right? But these teens already feeling tired might register that sensation and experience as, see, I told you my fatigue level is now worse because of the activity. So one, deconditioned, right? So physiologically speaking, it's reasonable to think that these teens are feeling this way after activities. Second one is even more so than that is a catastrophizing. So technically speaking, we're talking about the mindset. It's not that it's all in their head. Their pain and fatigue and all of these experiences are as real as it gets. So I'm not minimizing or being dismissive at all. But there is this thing called catastrophizing. So they're into three different categories. One is rumination. So you're kind of constantly thinking about how you're feeling in terms of the pain level or fatigue level and things like that. Like I'm already feeling dizzy and then look, this is getting so much worse, kind of thing. So like they're constantly thinking about it. And the second part of the catastrophe is also magnification. Like not that they're exaggerating, but like their thinking ability about how hard it's going to be is magnified, so like, oh my gosh, I'm already in pain and a little bit of movement is going to make it worse. So why do I do that? It's going to be even harder if I were to engage in any physical activity, that kind of thing. And then inevitably with that, they feel helpless. So it's like, well, I'm already in pain, I'm already feeling tired, and this is already super dizzy. So what's the point? This is all going to get worse. So it's that old trifecta of ruminating, kind of thinking about it a lot, and then like thinking that this is overwhelming, the magnifying, and feeling helpless. So that's all under the category of catastrophizing. After study shows that especially with the chronic pain, if there is a strong or higher level of catastrophe, have a harder time getting better from the chronic pain. But it's a real thing. So there is a connection there. So this is where the mind and body, they all go together. But this is part of the reasons why a lot of people mistaken, well, that means it's all in my head. Well, not necessarily. It's part of many, many puzzles. Speaking of which, the third component is the focus level. It really is about how much your child is focusing on what. So is your child focusing on what bothers them? So like dizziness, pain, fatigue, and all of that. Then of course, as the physical activity level goes up or gets moving to begin with, then they're going to focus on that, what is bothering them. And of course, that gets amplified, right? So those are the typical scientific reasons why these symptoms feel like and smell like super worse after the physical activities. But you kind of have to get over that hump in a weird way, because the consequences of not being active really is that your child continues to decondition, as you know already. And study after study says basically if your child remains deconditioned, then things are going to get worse. And if things get worse, then your child will continue to have a low quality of life or no life basically, and continue to debilitate. And the cycle continues to be around for your child and yourself. So what to do really is to start with something, the physical activity, again, baby steps, gradual process. And there's tons of studies showing why this physical activity is actually better, particularly with kids who have FND symptoms. For example, if your child is having functional seizures, getting into this physical activity, regardless of what, this particular study was looking at like dance and other like cardio activities. And guess what? 85 to 90% of the kids who were in the study, while they were engaging in these physical activities, they actually resolve FND symptoms completely. So I have seen so many cases of implementing physical activity and all of these symptoms, dizziness and fatigue and post-concussive syndrome and all of that stuff, including FND, gets better. Therefore, sometimes for your child, it could be just getting out of bed, right? It could be just starting to walk between their room, bathroom, kitchen, and it could be just walking around, and it could be just gentle yoga and gentle stretch. And for those who are struggling with POTS in particular, the recommendation is start with horizontal. So anything like swimming, right? Or like a rowboat or like bicycle, but you're like kind of laying down, that kind of thing. So those are the things you can do to minimize the chance of getting super dizzy, like starting with the marathon, kind of thing, right? So again, know your symptoms first and know that all of these things are related, and the physical activity, as simple as it is, can be the key to unlock all of these castles of FND, POTS, chronic fatigue, and other symptoms. For you parents and also teens, the basic thing that you need to know is that FND comes with so many different package deals, right? And then you don't really need to obsess and try to find every single diagnosis. At the end of the day, that will lead to medical fatigue, gaslighting, mistrust, and traumatizing for your child to go see so many different 700 doctors, right? So at some point, you kind of need to know, you know what? It's really hard to tease out what is what, but since my child is having all of these symptoms, let's start with something that my child can do, which is the physical activity. And don't ignore FND, because exercise is not the only thing your child needs to do. However, it's a good place to start, right? Because it doesn't cost you much to just walk around. And obviously, FND is a special problem that requires working with a specialist, especially for your teenage child. Because once again, teen FND is not the same thing as adult FND. But leave me a comment below. How many or what are the other conditions your child has besides FND, and you thought that by addressing POTS itself or post-concussive syndrome itself, everything is going to go away? Not quite yet, but I want to know. Leave the comments below. Well, thank you so much for watching this video. And if you like this video, you might like other videos talking about what else is going on, such as FND and EDS and post-concussive syndrome, and then how concussion can lead to FND and whatnot. Thank you so much for watching this video again, and I will see you in the next video.